Soft tissue surgery is a collection of surgery types that can be performed to improve obstructive sleep apnea. The goal of soft tissue surgery is to reshape and suspend areas of the upper airway. This prevents the tissue from collapsing during sleep and improves sleep apnea and snoring. During tonsil and palate surgery, your tonsils will be removed and the palate will be reshaped. Sutures will be used to reconstruct this area with the goal of bringing the soft palate forward and widening the airway. Often, the uvula will be shortened with a portion left in place. Some names used for this type of surgery are uvulopalatal pharyngoplasty, called UPPP, or another approach called expansion palatal pharyngoplasty. After this surgery, the recovery period is focused on swallowing and staying hydrated. During the first 2 weeks, your diet includes soft and pureed foods. During the healing, you can expect to have the following symptoms: difficulty swallowing, worsened snoring, severe tongue and throat pain, jaw and ear pain, changes to taste, and nasal reflux or the sensation of fluid in the nose when drinking. These symptoms improve over the first few weeks, but can take up to a few months to normalize. In the long term, some people notice that the sensation in the throat is different and swallowing can also feel different at times. After 3 to 4 months, your doctor will recheck your sleep study to measure your sleep apnea. If your doctor determines that they are appropriate, lingual tonsillectomy and epiglottis surgery are other upper airway surgeries, sometimes done in combination with palate surgery. During a lingual tonsillectomy, endoscopes are used to visualize and partially remove the lingual tonsils at the back of the tongue. The risks are similar to palate surgery, with risk for bleeding, changes in taste, and difficulty swallowing after the procedure. During epiglottis surgery, the epiglottis, a structure that covers the voice box during swallowing, is reshaped or repositioned. This is done using incisions and sutures. After this surgery, you may experience difficulty swallowing and coughing when drinking liquids. Some people may need to eat thicker consistency foods such as pureed or thickened liquids during this time. After any surgery, if there's any bleeding or difficulty breathing, you would come into the emergency room to be evaluated. Other types of soft tissue surgery are sometimes an option. For all soft tissue surgery, the goals are to improve snoring, reduce sleep apnea severity, and improve sleep apnea symptoms. The type and approach for each patient is unique and depends on each person's anatomy. Talk with your doctor to understand how these surgeries may help with your sleep apnea.